More and more, it does appear that the coronavirus will reach a pandemic status. I live in Idaho in the United States, and surrounding states have already started to report cases. It's just a matter of time that it's likely found here. So the question now is, what do you do if you or a family member think you may have the coronavirus? We'll give you some practical advice coming up. Welcome to Family Med. I'm Dr. Richardson, and this is your home for practical and accurate information to help your family make healthy decisions. This is the channel that focuses on bringing better health to your home. Now, we've been focusing on the coronavirus, just like many of you have been here at Family Med. Now, we'll be giving updates along the way on this and other topics, so make sure you follow along with us here by subscribing and hitting that notification button so you don't miss out on the latest information. So the question that we're going to tackle today is, if you think that you're infected, what should you do? We've seen that bit by bit, there are more and more cases of what we call community spread. In the United States, as of the time of filming, there are 99 known cases, and 30 of which are travel related, 20 are found to be person-to-person spread, and another 49 are under investigation of where they came from. Now, as you look at the map, you see some cluster of areas that are starting to be affected. Certainly, when some of you are even watching this video, this map is likely to have changed. But when you start seeing this, you inevitably start to wonder whether you're next. For example, here in Idaho, there's a lot of anxiety because of some of the close proximity that we're starting to see with some of those cases even found in Oregon. Now with that comes the big question. If you're sick, how do you know if you have it and what should you do about it? Well, the first thing we need to do is understand a bit better of what kind of symptoms you may experience with the coronavirus. Now this is where it's tricky. For most people, it seems that the symptoms of the coronavirus are likely mild and may present as just a bad cold. So does that mean that you need to go to the doctor and get checked if you start having cold symptoms? Well, the answer to that is an emphatic no. Please don't. I'll go over in a minute what you should do. But the three main symptoms that appear most common with a more significant coronavirus infection are fever, cough, and shortness of breath. Most cases that are reported have those symptoms. Now the problem with this, though, is that there's a lot of other illnesses that can present this way too. Your typical pneumonia or influenza, or even significant cold type symptoms can also present this way. Well, the first thing that we recommend is that unless you're having severe symptoms, stay home. One of the best ways that we can help prevent the spread of a virus like the coronavirus is to stay home if you're sick. Don't go to work, don't go to school or church, don't give your kids Motrin for their fever to get them through the day so they can go to the school and you go to work. Stay home. And if you're around people, then wear a mask if you're sick. Most of these types of illnesses are spread during the time that you're having a fever. So staying home and staying away from other people is the best thing that you can do. Now, if your symptoms are starting to get worse, if you're having difficulty breathing or you're not able to keep fluids down or other severe symptoms, then you do need to be seen. Okay, so let's say you do think you need to be seen. What do? Well, the first thing that you should do is call your doctor. Let them know what kind of symptoms you are having. Let them know your travel history or why you think you may be at greater risk for having the virus. Give them a better idea of what your risk is, and then in turn they can help you understand your symptoms and let you know if being seen really is the appropriate thing to do. There is a lot that can be done over the phone, and you may not need going after all. What you don't want to do, especially if this turns into more of an epidemic in your local area, is go walking around unannounced into your doctors. This puts everybody else at risk and makes it spread worse. It's much better for us to know if you're coming in so we can take proper precautions, give you the care you need while still protecting everybody else. If you are having severe symptoms, especially if you're having difficulty breathing, then certainly get to the emergency room. As you do though, make sure you put on a mask when you get there if you haven't already. Don't touch anything and cough into your sleeve even when you have a mask on. Tell them your symptoms so they can take proper precautions. Every emergency room has a contingency plan on how to deal with situations like this. Then finally, if you are sick, you need to take precautions at home to protect those around you from getting sick. Stay away from your loved ones, especially when you have a fever. Make sure you clean surfaces that you have touched or been around frequently. Use household disinfectants frequently on commonly touched surfaces. Now the good news about the COVID-19 and other similar viruses, they are killed by household cleaners such as Lysol or others. And the most important thing is wash your hands frequently with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or even sneezing. If you don't have soap and water, then use hand sanitizer. Now in our house, we designated a bathroom as a sick bathroom that nobody else uses during the duration of the illness to help prevent others from getting it. Now, one thing not to do. Please don't go to your doctor's office or the emergency room just to be tested and see if you have it. We don't have readily available testing for this. It's so new that samples still have to be sent to the CDC for confirmatory testing. So, recommendations right now are that we only test those who have had known contacts to the disease or contact with areas that have had significant outbreaks of the disease, or those who have more severe symptoms. Now, these recommendations are changing all the time, but certainly everybody at this point who has a fever doesn't need to be tested for the coronavirus. There's a lot of concern and anxiety in regards to the coronavirus. Not all of it without reason, because we still don't know a lot about what will happen with this. Because of that, it's up to each of us to take measures to prevent from getting sick and to prevent further spread if we do. All these recommendations are not specific to the coronavirus. Now, that's what we're worried about and talking about right now, but they apply to any infection that you get. Practicing these simple steps will help us not only prevent further spread of the coronavirus, but even more common things like influenza or other common illnesses causing germs that we're subjected to every day. This outbreak is a rapidly evolving story, and there are a lot of things that we just don't know about yet. So we'll keep an eye on the developments. As things progress, we may provide some updates in the future if there's more that we learn. Now, so you don't miss out on our future content, make sure you subscribe, hit that notification button so you don't miss out on it. If you have your own questions about this virus outbreak or anything else, make sure you let us know in the comments below and we'll try to answer it in a future video. But until next time, this is Family Med with Dr. Richardson, and remember, take care of your body, because it's the only one you have.